Data. Hi, everybody. Thanks for joining us today. We are in part 2. We're in the second session, and we're about to have a discussion about epidemiology, data analytics, and what it means to do this work. And we have 3 wonderful guests, but before we get to any of that, we have to start at the very beginning. And that is with our land acknowledgement, and then we will move through to our moments of silence. Then I will move into the introductions, the questions, and Q&A. So I'd like you to join me. If you can take a moment to get settled wherever you are, to sit as you're able, to lay as you're able, or stand as you're able, and to listen in and get in touch as we do the land acknowledgement. We'd like to start by acknowledging the land on which we are gathered today, and by acknowledging the caretakers of this land. This land is the treaty territory of the Mississauga of the New Credit, the ancestral traditional lands of the Anishinaabe, the Haudenosaunee, Ojibwe, Chippewa, and Huron-Wendat nations. As we think through our relationships, it is critical that we also acknowledge the settler history on which this moment is built, the past is built, and hopefully not the future. And I offer that land acknowledgement in this moment in history and in time where we have an opportunity to think through not only the violence of the settler state, but also to think about what are the possibilities for a peaceful future, and what do the treaties and what do the Indigenous legal systems offer us in ways of peace and understanding and living together. And so when I read this land acknowledgement, it is in recognition of an action, not just simply an acknowledgement. And now I'd like to move into our moments of silence. I'd like to recognize this is the decade of people of African descent. And I was reminded by an elder who asked that we acknowledge the struggle and the work towards reparations, and that we do that work collectively and thoughtfully. I'd now like to take a moment of silence for Regis Korchinski-Paquette. This is a young, Black, vibrant woman who was alive and well, and who died in the presence of police, like so many others before her. And despite inquiries and inquests, the same results still come to pass, which is where police are, extrajudicial deaths of Black people seem to occur, and that we need to remove that as a possibility by thinking through different opportunities of how we manage ourselves and each other that may not include the police whatsoever. So right now, I'd like to take a moment of silence for Regis Korchinski-Paquette, her mother, her siblings, her family, her community of which we all belong to. And if you can take that moment with me now, we stand in solidarity. And the next moment of silence and recognition is for all of those wonderful frontline workers, our Black frontline workers who have been keeping cities not only in Toronto and across Canada going, but have done so without the title or the supposed valor of being an essential worker. However, they still struggle with racism and the same kinds of experiences that we see people marching in the streets to roll back. And so this moment of silence is recognition of the frontline workers that are under-recognized or go unrecognized, the Black frontline workers who have already died as a result of COVID, and for those who currently are struggling with the failure of responses from their sites of employment, being turned away from tests, being turned away from having the resources that they need to keep themselves and their families safe. And so in this moment of silence, we recognize the sung and the unsung, those who were not essential yesterday but mean everything to us today. We stand with you, and in this moment of silence, we recognize the struggles that you undertake on our behalf. And we thank you. And we wish and we will work towards your protection. And this third moment of silence is not a last or a final one in that sense, but it's one in recognizing that what's going on in Minneapolis, across the United States, has always been going on in Canada. There have always been sites of resistance and pushing back. And it's so unfortunate that the only time sometimes that the media takes notice is when our bloods are spilt in the streets and left there. And so in this moment, I give recognition to the sites across Canada where we struggle, to our brothers and sisters in Minneapolis and across the United States, and to all of those who stand in solidarity, who are not Black, who push back, who pull away the tear gas, and who wash out eyes, and who open their homes, and who hand out bottles of water, and who inundate their reporters and their legislators and let them know that the state should not be committing violence against the people. The people simply are asking for our humanity to collectively be respected. And in this moment, I take silence in recognizing the trans folks through Canada, the US, and around the world who are experiencing a particular kind of violence and are not being seen. And so I ask that not only we see, but that we protect and that we stand within solidarity. And so for everyone on the front lines, for trans folks who are always on the front lines, for people living with disability, recognized and unrecognized, who inhabit all of those categories, the moment. And now, I'd like to introduce our discussants. We have 3 today, and I'm going to start off with Sam Tecle. Sam Tecle is an assistant professor of community engaged learning at New College, University of Toronto in Canada, which is where we are broadcasting from now. His work focuses on Black and diaspora studies, urban studies, and sociology of education. His forthcoming work, Black Grammars on Difference and Belonging, focuses on the experiences and perspectives relating to Blackness and Black identification of East African diasporas across the UK, Canada, and US. He has held graduate fellowships at both Harvard and Northwestern University in their respective African and African American Studies departments. And Sam, so I'd like you to take a moment to introduce yourself. And in that introduction, I would like to ask you to please give us a little bit of clarity about what does the term community engagement mean in your title.
Okay, thank you so much. First of all, Lana and your whole team, thank you so much for having me. It's an honor and I guess an odd pleasure in this moment to be here and to do this and to think about this while these kinds of ideas while perhaps the world is changing right underneath us. So for community engagement, I like to think about those two together alongside with community consultations. You could say that they're twins of a certain kind of sort. And we can think of the location of community engagement offices in universities, community consultations, the way city governments or local governments perform these kinds of things. And in community engagement and literature on that kind of work, there's no set upon model or framework, but there's usually a set of guiding principles that kind of inform the strategies or approaches, which are supposed to, I guess, engender participation, collaboration, empowerment, these kinds of really liberal notions of democracy. And I think from the perspective of communities that they're supposed to engage, usually marginalized, structurally neglected, lack of investment. So they're really usually Black and racialized populations. And I think from those perspectives, you can see that community engagement is in many ways extractive, which is it's really designed to extract consent or coerce consent in many ways, right? And we can think of these kinds of community engagement processes as not the places where decisions are made, but the mirage or the surface by which these institutions can perform a certain kind of a community-based accountability, right? So and I think of these community engagement moments or terrain as or participation as really rather parasitic rather than participatory. And I think that in the way in which these institutions or these governments tout community engagement, while democracy, equal exchange, partnership is always the aim or the goal, in many ways, it's actually structurally impossible for that ever to be equal. So, I mean, on my most cynical days, I often say that community consultations are very often white supremacy's PR strategy. Because I don't ever see the result and participating in some of these, right? So we can look at the history that informed the Roots of Youth Violence report. I was a much younger community worker when that was going on, or the very recent sham consultations the Toronto Police did around installing surveillance cameras in communities, right? So very often from the perspective of marginalized communities who would get certain kinds of initiatives stuffed down onto them and forced onto them, many ways, sometimes the only way we can slow it down is to interrupt them and say, well, you did not consult with the community. And it becomes the terrain on which we're forced to operate. So this is the way in which I think multiply located ways I think about community consultation or community engagement. And that's the terrain on which we so often have to struggle. And think of that, I guess, in relation or in contradistinction to what's happening on the street, what's happening across the Americas, right? So some thoughts on what I think about community engagement.
All right, that's very helpful, because one of the things we hope to do during these discussions is to source and share a vocabulary and tease out some meaning so that we can have a conversation together. I'm now going to go to Laura Rosella. Laura Rosella is Principal Investigator and Scientific Director of the Population Health Analytics Lab. She's an Associate Professor in Dalla Lana School of Public Health at the University of Toronto, and she's a faculty member of the Vector Institute for Artificial Intelligence and holds scientific appointments at the Institute for Clinical Evaluative Sciences and Public Health Ontario. She holds a Canada Research Chair in Population Health Analytics, Tier 2. So Laura, I'm going to ask you to tell us a little bit about you, and I'm going to ask you to clarify two things. One, what is population health analytics, and what is a chair, and what's a Tier 2? Because I know it doesn't mean that you're second, but it's something else.
Yes. Well, good afternoon, everybody, and thank you so much, Lana. It's an honor to be part of this conversation. So Canada Research Chair is an award that's offered to researchers across Canada at different stages. So the Tier 2 specifically speaks to individuals who are starting their career in research, typically assistant professors, and it's meant to sort of help launch their career. So it offers support for students and some funding. They're shorter terms compared to the Tier 1, and it's supposed to recognize sort of promise in research versus establishment in research at that phase. And so that's what a Canada Research Chair in. There are many across Canada. They're given from universities, and I hold one at the University of Toronto. And so Population Health Analytics is the name of the chair that I hold, and it's a name that you name yourself. And it's not a necessarily established term. It certainly wasn't at the time when I first received the chair, but I'll describe what it means to me at least, and what the term data and analytics means more broadly. And so this is really about using data that's collected at the population level in lots of different ways. So analytics, a very general term, meaning that it encompasses different types of analytics. It could be statistical methods, they could be descriptive, they could be predictive, they could be more complicated methods looking at mechanisms, but underlying it is some kind of data methodology, mostly statistics, I'll say, for the time being. And the population health piece is reinforcing that the purpose of that analysis is to reinforce the population application of that data, specifically for public health, which means prevention, health promotion, and equity. So the idea of using data, different types of methods to help inform decisions made for population health.
Okay, I think that's really helpful. And again, we're trying to build a vocabulary so that we can be on as much of a level playing field as possible, because many of us, including myself, until a few years ago, wasn't familiar with the distinction between the two, because these are the interiors of how academic research works. And so now we're going to introduce Pat O'Campo. Pat O'Campo, or Patricia O'Campo, is internationally renowned for her scholarship and methods development in social epidemiology, and has received Career Excellence Awards from the United States Centers of Disease Control, the American Academy of Pediatrics, the American Public Health Association, and the U.S. Institute of Medicine. Her research focuses include mental health, intimate partner violence, children's well-being, HIV prevention, infant mortality prevention, and homelessness. Dr. O'Campo is a Canada Research Chair in Population Health Interventions Research and at Tier 1. Hi, Pat.
Hi, so great to be here. And thank you for inviting me. And I'm really pleased to be here amongst these distinguished panelists. Let's see, I am an epidemiologist. I think everybody knows what an epidemiologist is now in this context of COVID-19. but I am a social epidemiologist, which means that I try and understand the ways in which our social environments and social structural factors affect states of health and well-being. And so that's to distinguish between many epidemiologists who tend to have a disease focus, for example, cancer epidemiologists. During my career, while I don't necessarily have a specific focus on how race-based data has been used to advance ideas in epidemiology, I've certainly written about this topic. Epidemiologists can sometimes use race-based data to unintentionally default to the erroneous idea that racial categories reflect biological differences, and so that is something that I've written about. My CRC chair in population health intervention research really focuses on the ways in which we come up with solutions. So a lot of what happens in epidemiology is it describes problems, sometimes quite in a sophisticated way, but my chair is about coming up with solutions, partnering with communities and affected communities to come up with effective solutions to address the problems that we're facing in urban environments today. And I guess one last thing I'll add is that I have been in Canada for 16 years. Prior to that time, I was a tenured professor at the Johns Hopkins School of Public Health, which may be relevant for this discussion since there is differential access to race-based data in the US compared to Canada, and different kinds of uses of race-based data in the US compared to Canada. And I can certainly draw today from both of those perspectives.
Wonderful. And Pat, can you tell us a little bit about the tier 1 that you hold? Like, what is that tier 1 part about?
Yeah, I think the tier 1 is really that I've been doing this for a long time. The tier 1, as Laura suggested, is for somebody who has established themselves in their fields and has had a number of accomplishments. And so that's kind of what the tier 1 refers to, somebody who is at the level of a professor.
Okay, thank you. That's valuable and important because I think it helps people understand the ways and things are framed and some of the resources that may be available to them on various different campuses, and to kind of understand how structure works. So now we're going to move into the discussion part with our discussants. And I'm going to start off with asking Sam the first question. And I'm actually going to, after I ask Sam, I'm going to switch it up a little bit, and I'm going to bring in Pat right after you, because she left on that note around her experience both being in Johns Hopkins and living in the US and living in Canada. So I think it will help flesh out some things that have become part of the conversation in the normal context. So the first question for you, Sam, is, are all Black people, the question we've asked across all discussants, are all Black people asking for the same thing when race-based data is being demanded? And what are some of the tensions that you are aware of?
Okay, I think it's an important question, and in so many ways, an almost impossible question, which I think harkens back to its need to constantly be asked. I think Black people want to live full and meaningful, substantive lives. And I think, at least in the work that I do in the community-based research, or the research that I've done to try to get between that place where a place of precarity to a place of getting increased resources for communities. In many ways, how do you bridge that gap? And I think sometimes, rather than in the narratives that we produce, there's something called data that gives that some more value. And I think that in of itself is a tension, because what happens in a call for something called race-based data, it limits what data could be, or what can be understood as data. What is legitimate data, right? And in so many instances, I've seen the problematic nature where there's been a set of Black people in a certain community speaking their truth in so many ways over years and decades. But when researchers come along and put that up and write it up in a pretty paper, that becomes something called data that actually moves. It actually does something in the world, limited as it may seem. I think that in of itself is a tension I find. And I think, as I tell my students always, is I don't do research for research's sake sometimes. I actually want research that lives off the shelf, whether it's something conceptual or imaginary or actual and practical, I think it needs to do that kind of work. And I think it also needs to be said that there's also many who are Black and racialized who are not interested in that kind of ethic, who are really doing research just for research's sake. And I've often put out there on Twitter that counting Black death is not a research program, but so often it is a research program that will get funded and it will get accepted and legitimized in these fields, and especially in particular disciplines. So I think, at least for me, and I'm early on or early year career, or whatever they call it, but it's a tension that I see as an important one.
Okay, and so I just wanted to circle back, because you said, communities are seeking justice and they're articulating their real lived experience and the issue that is before them, but there seems to be a magic translator machine that shows up and that wants to then turn that into something we call data, and that data becomes a proxy. It almost sounds like a substitute for the justice that was being articulated by the individuals. Am I?
Yeah, and I think if researchers, Black especially, could be utilized in this way by institutions, right? That they could be tapped to say, you're this person who will speak for that community, and of course, complexity within the Black community or Black communities are of course present, but there's ways where researchers or subject matter experts can become the person that institutions tap to become the spokesperson, to become the junior partner, to become the Black person, the magical Black person who will explain or quell a certain kind of rebellious rage or a certain kind of truth from being spoken, right? And I've seen that myself, where I've seen you go to meetings, you go to community consultations, you go to town halls, and there is a palpable rage, palpable disgust or anger that's speaking, and it's beautiful. It's unwieldy. No one is doing the 2 minutes at the mic. It's yelling at the city officials or the educational officials. That doesn't happen when you do a community consultation, right? That rage or that kind of rebellious energy doesn't translate into a nice report. And I think we need to be especially hesitant of those kinds of things, right? Are we partnering with police to produce research reports? Are we partnering with racist school boards? I think those are questions that researchers, especially Black researchers, should be grappling with, and should, if they are, maybe have some difficulty sleeping at night. So I think you could become the handmaiden to just continue the same kinds of structures that are already in place. And I think for me, that's not the kind of work I'm interested in.
Pat, I'd like to bring you in here, and I'm wondering if we can talk about two things. One is the tyranny of the expert. We can come to that last, because part of what you've brought up is the tyranny of the expert, and something that I've noticed very profoundly being present during the pandemic, as it was before, but even more so now, is what I call expert drift. Folks who happen to be one thing, and you'll hear a bit more about that on the panel tomorrow with the public health, emerging physicians, and researchers, the next gen conversation. And so, Pat, can you talk a little bit here about the translation from a science perspective? What are some of the pieces that we should be thinking about in terms of what Sam spoke about?
Yeah, thanks. I guess in my remarks, I want to make a distinction between thinking about calls for race-based data within science and to use it within scientific publications versus the public calls for race-based data. I think to use them to try and understand what's happening in a setting, a population, in a situation. So for example, the NDP has called for race-based data so that we can understand the situation better. And I hear a lot, if we think about the public situation for a moment, I hear a lot that the reason that we need race-based data, or that we should measure race on data sets, is to address the issue of racism. And I even read, for example, in the Government of Ontario data standards for the identification and monitoring of systemic racism, that having race-based data is one way to do that. And one concern I have is that measuring a person's race and aggregating that data may actually not shed much light on that. So, as scientists, we're supposedly really smart people. I don't understand why we would need a proxy for something like racism. Why not measure the issue that is the focus of our interest? Why not measure exposure to racism? Or why not measure, better yet, I think, systemic racism? One of the problems that I see when we measure an individual's race, and we'll put aside for a moment, what does it mean to measure a person's race? But if we measure an individual's race and we group everybody together who has the same race, we end up with groupings of persons who are quite heterogeneous. And it's hard to know what conclusions we can make about these groups of persons who are extremely heterogeneous, including their experiences of racism, their class, all kinds of things that might differ within that racial group. But we often compare the race groups with one another and try and make some conclusions. But the problem with measuring race or even social determinants of health, and especially in my field. So in my field, we rely heavily on data at the individual level. So we end up making a lot of inferences about individuals. So did their race mean something about the access to healthcare, or did their race mean something about whether they were ill or well? And we end up focusing on individuals or groups of individuals when we're really interested in the social determinants of health. And those social determinants of health are usually upstream. And if they're upstream, then why can't our focus of our research be more upstream rather than on individuals? I doubt we're going to find the solutions to what we're looking for if we just focus on individuals. So I think there's a lot of problems calling for those kinds of data to try and understand issues like systemic racism.
I want to say thank you very much for that, Pat. That's a really important piece and something I've been talking about for a long time, and you've been talking about it for longer than me. And I just want to share with the folks that are listening and watching that I came to know Pat's work a long time ago when I was nowhere near university. I won't say how old I was, but I was nowhere near university because I was a kid. And there was an article, and some of you may remember this, when the bell curve, the book in the article and the discussion around the bell curve came out, that said that Black folks were collectively less intelligent than white folks because of scores on a test that was culturally defined and caused scores to be lower for those that didn't share the same culture. And I remember very distinctly arguing my points, not having the background in biostatistics or anything at that time. I held onto that article fiercely, and I was citing Pat's work. And so it was quite a thing to have the opportunity to bump into you when you moved to Canada several years ago and actually meet face-to-face this individual's work that I had been actually shoving in the face of my school peers who were trying to say that as a Black person, I was less intelligent simply because I was Black. And so I think this ties very, keenly into the conversation that we're having, which is getting race-based data. And I just want to repeat it for folks what Pat said. And it's important for us to understand that measuring my race, adding my race to a category of categories cannot get you to the thing that we are actually asking for, which is to understand where and how racism is working in order to remove it and extract it from our lives. So simply marking us as Black, as Asian in these very racial categories that come out of enslavement and profiteering cannot get you to the place where we want to go. And so folks that want to give us false claims about accountability and we need to know, we have, as we've said in other episodes, by folks who are experts on race and demographics in the US, we shouldn't do it the way America has done it. America did not use those statistical designs to advance or to roll back racism. Those were instruments and continue to be instruments of racial capitalism and managing a highly racialized society. And so on that note, I'm going to bring us into a conversation around how might collecting data on race, as well as other sociodemographics and social determinants of health, endanger populations that are already hyper-surveilled. So let me rephrase that. How does marking people's racial categories in research, and how does, for instance, including their income, which some people are calling for, further endanger the very populations that supposedly this claim is being made on the behalf of. And Laura, we want to pull you in here. Can you just share your thoughts on how that might work and where that danger may be? Can you kind of explain what you can see from your perspective?
Oh.
Unmute.
Okay, there we go. There's a tension, right? And I think for those epidemiologists and many people that work in public health, they want to bring light to an issue. And especially when the people around them or the policies around them are not reflecting what they know to be true, that those structural issues exist. And so this becomes a point at which they think, this is how we do it. We're going to show people that these are problems. But there are risks to that, certainly. Two major ones being, first, stigma. So, of course, when someone does this analysis and they are hoping that the results are interpreted, very carefully and very benignly, they cannot guarantee that. And so the story that gets told with these data can actually further stigmatize these communities, individuals, and that can be personal stress on the community, and have, of course, negative health effects. So we actually may be pushing things in the other direction by these stigmas that we're drawing attention to in these populations. The other piece is that it may cause us to focus on the wrong things. And this is where I'll admit, as epidemiologists or analysts, most people that come into the analytic field started in more of a, let's just say, math or stats background, and then decided, well, what am I going to do with these tools that I now have? Oh, health would be a great place to start. So they don't necessarily start from, let's say, public health perspective or even health perspective. And then those analyses are being applied, and we're not thinking through the fact that it's going to cause whoever's interpreting those results to focus only in on those results. And the examples that you're talking about, only race versus racism, only on the individual characteristics versus the structural characteristics and conditions that have created those outcomes. And so those are the two concrete risks that happen anytime these data are collected, and if safeguards aren't in place, or if not done correctly from the beginning.
Sam, you want to add some thoughts in there?
Yeah, I think pulling back in just on the idea of race-based data, or these calls for that, I think very often the collection of race-based data, or the call for the collection of race-based data, simply results in the production of race-based data, right? It doesn't actually, in so many instances, doesn't materially result in redistribution of resources, increased investment. Very often that portion of that project, I think the Justice Project or the Making Black Life Project that I find, it doesn't result in that. So simply it becomes, again, a re-articulation of that same kind of extraction, right? So I think that's something that we all need to be on guard for.
We've got a question coming in, or a statement, and it says, I want more race-based data, but we need more checks and balances to prevent using this data to misrepresent facts and paint a different picture from reality. And so I'm going to jump in and kind of weave this into our next piece, which is often people make requests for things that they don't understand how they function on the back end. And that's part of what you brought forward, Pat, Sam, and Laura. And I think one of the things that's incumbent on us to do, since it is the academy that produces this understanding that we have, it's not an organic understanding by any means, is that race-based data is a concept that we've invented, that we've pushed, and that we've gotten people to believe. So we've made something, it's been sold, and some people buy it, some of us don't. And I think that one of the things that's important is to be informed about what it is you're choosing to take up. And so part of being informed is knowing how things work on the back end. So when we say we want more race-based data, we're actually taking resources from something that we might need and probably want in order to accomplish an outcome, and using it to engage in a form of scientific voyeurism. So one of the biggest concerns about race-based data is the sheer amount of money and time that is used to curate this and who that money and time goes for. Because those of us who have entered the academy or who've been around it can tell you there aren't a lot of people that look like Sam or I. Those $100,000 plus jobs don't go to us. We are the smallest portion of the academy, and rarely is it our community members who ever get hired in any capacity to analyze or share that data, except for when they think there's going to be a conflict and then they trot out the Black person or the whatever person. And so I think it's important that we understand that when we make calls for race-based data, we are taking an entire system and all the money and energy that goes with it and taking it away from housing and moving it away from access to timely care and moving it away from the solutions that communities have named and into an academic processing machine that has nothing to do with where you live and, quite frankly, nothing to do with the life that you understand. And so when we ask for race-based data, I think Pat's advice would be well taken, as is Ruha's, as is a number of experts that are invested in our communities, which say, solve the problem that you have, not the one someone's invented. And the problem we have is a problem of racism. We don't have a problem with race. I'm not actually Black, as you can see. I'm a shade of, I don't know, a couple of shades of, I don't know, something good and yummy. But I'm not a Black person. That's an invented thing. So why do we want to spend time in pursuing an invented category that in no way represents who I am? But racism does represent the lived experience of walking while Black, shopping while Black. And let me tell you, being in the PhD in the Faculty of Medicine at the University of Toronto has meant that even entering the building that I do my research and studying in is an intrepid category. Like, do you belong here? Do you know where you're going? Can I help you? Having security guards constantly walking by you, trying to help you. And that help is not the help that my white classmates get. And so I think it's important that when we ask for something that we know what it is on the front side, as we say, and on the flip side. So now I want to move to the next layer of that question around how might sociodemographic and race-based data somehow need to be troubled. I want us to think about this question that we've gotten several times over the course of this series, which is, what's going on with the doctors and the EMRs and the EHRs? And so EMRs, the acronym is electronic medical records, and that's the electronic version of the paper file that you may have been used to. EHR is an electronic health record, and that is the digital format. It's very animated. It can talk to other health records. It can communicate to other hospitals depending on how it's been coded and programmed. So one historically came out of just a paper conversion, and electronic health records are an embodiment that's always been, for the most part, electronic and able to move around. And I'm asking this question because we've had folks message in and say, you know, I find it very curious that my physician spends a lot of time typing things into this machine. I don't actually see what it is. And given the data goes places, why are they trying to get so much information in there? And what are some of these pieces that I've seen around physicians trying to get us to put information that they consider private and intimate into this record? Can either Pat or Laura kind of take a whack at this? And the undertext or the small, when they were trying to explain what they meant, was they don't feel comfortable with this much information going into a place they can't see. Can either of you or both of you kind of help us think and understand what some of those things that we can't see might be?
Go ahead.
Sure. So, I mean, there more and more data are being collected digitally and going into these records, as you've mentioned. I think the big question and something you're raising is, who's using that data for what purpose? Who has access to it? Can I see it? Who can see it? And those are the questions that we don't always know the answer to. It's not clear. It's not always thought through. When somebody says we need to add this data field because we know it's important for X, Y, and Z, and that data field gets answered, all those other questions I just asked usually aren't discussed. And I mean, for the most part, when these data are integrated, it's touted as improvements for the health system, a way to monitor the health system in order to make sure that there aren't gaps, quality improvement, making sure that you're providing better care to the patient in front of you. But of course, there's a big lack of trust there and a big lack of transparency of how that data is being used and for what purpose. And I think that underlies some of the issues and discomfort that we have with that data, and understandably so.
Okay, and I'm going to just also take on to another piece that's come across my screen, and one of those questions is, given that we don't know who can see our data, and they've seen things on insurance claims around third parties being able to see their health records, isn't this a concern? And so I'm actually going to ask you, Pat, to just think out loud a little bit around when we think about interventions and we think about a just life, when a person that is potentially labeled Black because of race-based data is asking a question like this about what does the insurance company see, like what does this mean? What might be some of the educational thinking that we should have? So Laura posed some questions, who's seeing it, da-da-da. And from your end, having been from the US where we've seen the impact of what it means to have race and insurance come together, can you share a little bit about that?
Yeah, I think these are really great questions. I think the first thing that I want to say is I think the burden should be on the insurance companies, or even the individuals who are collecting data for EMRs, to tell you why they're collecting any information, including information on race, and as Laura said, how they're going to use it and who can see it. I guess one of the concerns that I would have is that medical sciences, so epidemiology definitely derives a lot of its theories and ideas from medical sciences. Even though I'm a social epidemiologist, I have to say that we are closely aligned with those in the medical sciences, and they tend to draw their theories from biology and medicine, more so than sociology or political science. So when you have a variable like race, it creates a bit of a blind spot within the discipline of epidemiology or within health sciences, because they're relying on this idea that many of these variables are biologically based. And so I think you can see from the science that epidemiologists put out that there are suggestions that race has a biological component to it, whether that's genetic, or whether there's some inherent natural difference by races in individuals, which we know that many of the other disciplines, whether it's biology or genetics or anthropology or sociology, they have all rejected the idea that race is a biological variable. Yet I can tell you that in health sciences, there is this strong suggestion that race is a biological variable. So getting back to the issue of medical records or insurance around health, I would worry that they're somehow assigning some kind of biological meaning to the idea of race. And we know that that's not true, and we can come to some wrong conclusions if we assume there's a biological component to race.
I think that's a very important thing to think through, that we're not all trained similarly, nor are we trained critically for many folks in the fields that are the ones that generate the analysis that policy decision makers often use. And so here's a question. It says, "Hi, Lana and speakers. I have heard about efforts to integrate data on race and other life circumstances like housing and income into EMRs. Is this a good thing? What unintended consequences exist?" And so I'm going to start with Sam, just to pull you in here. And from the perspective of a community that you've worked with and lived in for a long time, you've seen how unevenly discipline and force are used and resources are used. What do you think when you hear that question about what might be the unintended consequences?
I mean, I don't know about unintended, but I think I know what it will reproduce. I think the same kind of stigma that we've discussed, or that we've been hesitant about. We can take any example of any kind of municipal or provincial or federal piece of data that is meant to articulate, I guess, the condition of whether it's Black, Indigenous, or people of color's kind of life chances, life experiences. Very much how that data gets taken up is simply a blame of the fact that a very ahistorical reading, right? Like that the conditions that are presented in this report are because of the choices, the life chances that these folks have made, right? Rather than a report that really, or research that really engages structural racism or the history of this country's violence, studying race or making race a variable, be it biological or not, it very much gets taken up in that way, because there are very few research projects, I think, that really account for how do we tell a story of the violence that has been inflicted, of which the university has played a role, right? Of which research has played a role. So I take Laura's point in when teams of like epidemiologists are in the background saying, oh, we can't release these kinds of reports that blanket whether it's a city, a province, or a country, because it will introduce stigma. But that stigma has always been there. That history is there. So it's in that context that work is being done, right? So it behooves us to ask ourselves as researchers and as ones who work in the university to think about the ethical implications of that work, right? So you had Professor Idil Abdullahi on a previous session, and she has this term called ethical grappling, right? I really wonder what might be the process or the internal framework or questioning beyond the ethics processes that we're mandated to do by our federal, because those are wholly inadequate. But thinking about does a researcher really adequately ethically grapple with what it might mean to do this work in contradistinction or against the way all other research has been done? And I think that's not very, very often a question that's asked. If one is not held accountable by the communities with whom they research on, right? So I think that's another layer of a kind of ethical grappling that I know I would have to do because of where I place my investment and to whom I'm committed. And I remember even when I just started teaching at U of T, I said I know who I'm accountable to, and it's not a faculty committee, right? That's just my work. That's my ethical orientation. So that makes me do a whole other set of ethical grappling. And I wonder if our colleagues and our partners and I hope our comrades in the struggle for justice on the science side would take that into account in not only the execution of the research projects, but in the constitution of the projects themselves. So that's how I kind of approach that, and that may be something that's perhaps much more amenable or applicable to social scientists, but I don't know if I want to go that far yet. You know what I mean?
No, I'm going to actually bring in Pat if I can, because I think this is where there's a wonderful connection to expert drift, especially here during the pandemic across the country. But Ontario does have a way of being the little engine that could. So a lot of it comes out of here. So Pat, can you kind of make some links here between a concept that we in the community see glaringly, which is expert drift, and the relationship to the question of that came across our screen around what does it mean to have this increasingly more intimate information about our lives being poured into these management systems, supposedly for our own good, but we're never told what that good is. So talk to me about expert drift.
Okay, love to. But I also want to make links to what Sam just said, because I think we haven't actually said this yet. But before we even start to consider whether or not we should have race-based data and what we should do with it, we really need to ask those groups who are affected by this the most to really be at the table. And I think that gets at the ethical principle that you mentioned, Sam, that we really need to be partnering or taking the lead from those communities. And that does happen within the health sciences. We do community-based participatory research and try and take the lead from community. And hopefully that will take care of some of the problems about who should be answering about whether we should be using race-based data, how to use it, who can see it, etc. But I did want to weigh in on that point, or the question that came across about within the health sector, trying to get more information on race, but also on other issues such as housing or employment. I guess one of my concerns that I have is that how well can you screen for some of those things? So I'm assuming that you would screen, for example, for whether you have adequate housing, and you might screen about employment or some of these other social determinants. And, while I think it might be well-intentioned, I'm just wondering to what extent the screening process can really reveal the nature of the problems that an individual might be facing around employment or housing. Because to understand a person's housing situation or even financial situation, to be able to link the two to get to adequate housing, it takes a long time. And so simplified screening often does not reveal what a person really needs. And then to me, it begins to get into that expert drift. Is the healthcare system where we really want to be learning about where I can find a great job for myself or where I can get great housing? I think maybe we would want to go to another sector, a housing sector, to really learn more about housing and to figure out what my options are. And so from that sense, I would have concerns about trying to make the healthcare system the place where you get screened for everything, because I don't know that there's expertise. Certainly there's expertise in healthcare. I certainly want my health taken care of by doctors, but I don't know if I want my other social determinants taken care of by the healthcare system.
And Laura, can you weigh in here?
Yeah, I wanted to follow up on something Pat brought up that I think is really important and maybe explains some of the simplicity that we seem to have in this space. We can't get we know that there's these structural issues. We know they're important, not everybody, but many people do. And we still go back to sort of simplistic ways of measuring it. And why is that happening? And this is a question I've asked myself for sure. And I think the measurement is where we get stuck. So we know we have to measure racism and housing and all of these other things better, because that's actually going to lead us to the solutions that we need. And then we get stuck there because we haven't had a chance to think through those issues as critically, and maybe there haven't been those given the opportunity to do so in the same way that we think through biomarker measurement. I mean, we can measure the most sophisticated whatever of the cellular processes, but we seem to not be able to measure or have access to good measures of the things that are really mattering for the health of populations. And I wonder if that's an area of activity that, if bolstered, could really help.
Mm-hmm. Mm-hmm. And I think this this piece, I want to pull Pat back in here to see if you have anything else to contribute, please.
Yeah, so Laura, I really like this kind of thinking about the way in which we do things in our science. I think one of the things I noticed a long time ago, not just within the health system, but I know that this has also been known and written about in sociology, in looking at the problem, the seemingly intractable problem of poverty, and how our data and research contributes to those solutions. And I think in both areas, whether it's health and whether it's sociology, trying to look at solving the problem of poverty, somebody named Anne O'Connor wrote, in fact, about this issue. She noted that in the late 1990s, when I think both countries did some reform around welfare, they relied heavily on their best scientists to come up with the solutions to poverty and solving it. And what she noticed is that both sociologists, and I would have to say in the health field, we do this too, we're really great at finding data sets on individuals and then taking massive data sets, longitudinal data sets on individuals, doing sophisticated crunching on those data sets. But what those data sets tell us are about characteristics of individuals, and that's not where we're going to find the solutions. We need to study policies. Are the policies themselves equitable? I don't want to say it doesn't matter what's going on at the individual level, but if we keep our gaze there, we will never move upstream to where we need those solutions to be. In fact, that's kind of what my chair is about. It's moving upstream, coming up with new methods where we can study upstream policies and not worry as much about those individuals. So Anne O'Connor concluded that we've spent millions and millions of public dollars on crunching individual data sets, and the kind of solutions we came up with was well, we need to stay married and we need to get an education. And those were the solutions that we came up with poverty, for poverty. And I worry that we're doing the same thing with health. We're crunching all these big data sets on individuals, never looking upstream at how are the hospitals treating us? How is the healthcare system treating us? Are our healthcare systems accessible to everybody? So I do think that we need to rethink some of the emphasis that we place on data sets that are all about just individuals.
How do we balance the need to prove healthcare inequities via data and not, as mentioned, perpetuating certain stigmas? Who owns the data once it's collected? For example, the Black Experience Project in the GTA. So for our Black community members who are from the GTA, the Black Experience Project that happened a couple of years ago, and others by its name, have been deeply problematic and caused a lot of stress because of the ownership issue. So I'm going to take this to Sam. Sam, I'm going to ask you to take both halves, and then I'm going to circle back to Laura and Pat on another piece. So here we have a situation where we have somebody asking about the ownership of data, and what does that, I think it's, in essence, what does it mean for that kind of data to be out there, and who owns it? So, and if you are comfortable, share as much as you can by giving an example, which is the one that cited the Black Experience Project.
Okay. Yeah, so I want to start maybe with a short story. I remember a very prominent criminologist professor came to talk to us at York, and she gave her whole talk and talked about having PhD students, white PhD students, who she was supervising, and then at the end of it, she, in a moment of kind of, I guess, brutal honesty, she said, I have all these students, these PhD students, where they want to go, study in Jane and Finch, or they want to go study at like Dufferin and Lawrence, or they want to go to Scarborough and study. I just can't understand it. And I was so flabbergasted by that comment, because I think her criminology as a field, you would understand the desires that are produced in your PhD students to want to go study in Black and racialized communities where they think criminology happens, right? So if you study an entire field that perpetuates the fact, like urban sociology, you're supposed to go find that data, or it's at least inculcated in that field. You go there and study it, and she was flabbergasted by that. So I say that to say there are certain ways in which I think we even think about fields and discipline and train PhD candidates or researchers that reproduce that they then, without a critical lens, they would understand that this is my job, is to do this kind of work. Right. And I think with respect to, I guess, proving inequities or ownership of data, my question would be proof to whom? Right. I mean, I think we already have a deep understanding, I think, of the way in which Black life, for me at least, is organized in this city, or I mean, in my community, in this city, in this province, in this country, and perhaps, this side of the world. I would say we have deep understandings of that. We know that. So to whom is that project aimed? If you feel like one of your goals of your project is to prove inequity, that would be, I think, one part of my inquiry to the question, right? And then again, I mean, who owns the data for the Black Experience Project? I would say, not to be glib, but not Black people, right? In many ways, right? So we can already think about perhaps the kind of ethical grappling I referred to earlier perhaps didn't occur, or the better question being was, how could such a project be conceived, enacted, produced, and then that these concerns show up later? Because these are this is the exact way in which research ethics and research projects, especially involving Black communities and otherwise, get approved. So this is I would believe the concerns at the back end are more a reflection of its intended operation, rather than saying, oh, how is this the outlier? I would say, just like with the story with the criminology professor with all these students who want to go to poor Black working class neighborhoods and do their criminology projects, or the Black Experience Project, we could very much say that many Canadian universities, perhaps departments, research institutes, or these kind of tertiary research outfits, that's the kind of work that they produce, that they propose, and then get funded, and then produce, right? So, and I think in that case, again, just like I said earlier with community engagement or consultation, the goal is just to extract data, extract narratives, to extract some sort of legitimacy, you know, these kinds of things. And to me, I'm very hesitant of, I guess, these kinds of projects, because we can like, the jig is up. We can see that from the beginning, and I think what then the question then becomes, what is to be done? And I think refusal in many ways, right? Refusing our participation. I'm always encouraged by June Jordan, who says, you know, if you give me a chance to tell the truth after you've kept me quiet for so long, it's going to be an ugly truth. And if these projects don't get at that ugly truth, or the real, I think, you know, experiences without this kind of, you know, watered down by variables or narratives in particular ways, then I think it might be a project we would reconsider doing or participating. So those are some of the thoughts I think I have for that question and some of the earlier points.
And I'd like to pull some things forward from part one, because we had some amazing discussants in part one as well. And in part one, in sessions 1, 2, and 3, this concept of proof came up several times. And I'm going to refer in particular to some words that Ruth Cameron said. And again, another one of us who entered the academy and is doing PhD studies, because we were literally fighting down the institution to get this done right. Because as the saying goes, if you want it done right, do it yourself. And so Ruth articulated, why are we not the trusted narrator? Why, as Black people and as Indigenous people, why are we not the trusted narrator? And when she said that, I circled it as I was, you know, making notes as she was talking, and I thought, and that is a long-standing question. It has been asked over the decades in many ways, but she articulated excellently when she said, why are we not the trusted narrator? Why do we need folks who are not from our communities, who have expert drift, who are doctors or criminologists, who now decide that they can weigh in on what Black life should look like, when we have been successfully managing Black life in the face of extreme white supremacy and other kinds of exclusion, rather than trusting the narrator, who has already drafted, as we have amongst ourselves, many solutions and are enacting them. And if, in fact, the state and the policymakers and the politicians would actually kind of get out of our way and stop harassing us in our neighborhoods and in our lives, we could actually produce some pretty amazing outcomes. And so the expert drift, I think, comes in here, and that was suggested, but this idea of the trusted narrator. Do you need to continually prove an inequity when we're physically living it? Who, as you said, Sam, do we need to prove it to? And I would argue, as my father said, this is a fool's errand. That when you are living an experience and someone who has caused that experience collectively through their colonial processes and policies then says to you, prove the harm that I've inflicted at a structural level, it is a fool's errand. And I would say that as Black folks and as researchers, we're really smart people. And I think the work of Aruha Benjamin and so many others around informed refusal is important. And informed refusal is what we would collectively say as hell no. It's like, no, we understand what it is you intend to do, and we do not agree because we are fully informed, and therefore we refuse. And so I think it's important to tie together the right to informed refusal can only exist where things are transparently laid out, and that the academy and policymakers aren't the one painting the picture, that in fact we're the trusted narrator, and that we narrate what is happening and we act on that narration. And Pat, can you pop in here for a minute? I'm just thinking about interventions and thinking about what you might have to offer here.
Yeah, so I love that that idea of the trusted narrator, because I think it brings up a really important issue that we've not really talked about. And let me just step back before I get to that issue, and that is another concern that I have about focusing so much on race-based data and analyzing it well and all of that, is that there is a belief, and I think it's a wrong belief, that somehow this technology of data is going to solve our problem. You know, so the proof, we have to have hard data. We can't have soft data or narrative data. We need to have hard data. And once we have it, and if it's accurate, somehow something is going to happen. Things are going to change. And I think what that does is it blinds us to the fact that really this is about power and politics. That's what's going to change things, not data, not race-based data. And in fact, sorry, you're never going to be a trusted narrator because people have a lot to lose if they start to trust your narration about whether you're getting great healthcare or not. There are groups who want to protect the power that they have, access to resources, so they don't want to believe you that you're not getting equal access to certain resources. So we can talk a lot about, should we measure race? Should we measure it this precisely? Should we measure it that accurately? But in the end, technology is not going to change things. It's about power, and it's about access to resources, or threatening more equitable access to resources so that some groups have something to do.
I think that's a very important set of points, and it underscores what Sam said. It also underscores the discussion that we had on Saturday last week, just gone here with Ruha, when she actually spoke to, along with the other discussants, the reality that, data, as my colleague C.N. Wilson says, data won't save us. And it can't do that. And it's political will. We know that for the dominant society in settler societies, which is, white European descendants, there is no data for why they should be overrepresented in every career that earns the highest amount of money. Like there's no reason for that. They're not more intelligent. The data shows that. But yet the political will to ensure that white people do well is there. And we saw that even with our premier as he tried to place people in positions that they had no qualifications for. How do you pay somebody $125,000 that doesn't even have the basic requirements? Well, he showed us by his action that as long as he thinks it's politically expedient and powerful, that you can just hand resources over to white folks, but yet you can't find the political power to evenly and fairly distribute resources to the people who actually generate them versus the dominant culture that siphons them off. And so here's a question we have. Does the community sector call for race-based data increase the funding for research and access to data? If so, what are the consequences of that? And I'm going to start with you, Laura, to pull you in, because as a lab, I'm sure that you are often somebody that they might call up and look to engage in this kind of activity. So again, the question is, does community sector calls, and let's be clear that that community is not the pedestrian everyday Black community, is coming from a very specific set of elite Black community members in this current edition of that call. And so does that call then move funding towards the research to generate that data? And what are the consequences of that? Laura, and then Sam, and then Pat.
Yeah, I think it inevitably does. Anyone would be naive to think it doesn't, because if someone has articulated that this is important and it looks like that is coming from a community and that is being affected, then all of a sudden that becomes a priority for funding and that becomes a target for research. And so I think absolutely that can happen. I think just speaking from, and even when Pat was talking about the, if I just show them the data, they'll change. That was me as a PhD student, literally. I think I said those words because I was so passionate about the ability to use data to change. And I naively thought that was going to happen. And then I, published my paper and I was like, no one's using this and no one's using it the way I wanted them to. And I had no concept of why that was not happening. And so, I think we need to get at that a little bit if we want to turn this around, because I think people, some people, it's hard for them to tell the difference when all the messages are coming at them and people are saying, you need to do this because this is what's going to help the problem you're passionate about solving. And then they don't know what to make of it. And so we need to get at what's underlying that so that people like me and others have the courage to say, no, actually, I can't do that analysis. I'm going to cause more harm than good. Or no, even though I'm going to lose my funding this year, I can't apply for that research call because I know it's not right. So I think it does create those incentives. We are driven by incentives, especially in academia. And we're driven by funding incentives and research incentives, and we're judged by what the international people in our field say about us. And that's what drives the type of work we do. And unless we start getting at some of those things, I think the change is going to be really hard.
Yeah, and I'm going to bring this over to you, Sam, and then to you, Pat. And I think what you just said, Laura, I want to underscore it. I don't want that to be missed because I know some people are, in motion as they're listening to this or trying to get ready for the next call that they have. So I wanted to underscore that in fact, it would be naive to think that simply producing something produces change. We've heard that across all discussant sessions. And the other piece is that you're incentivized. And one of the reasons I brought attention to the tier 1 and the tier 2 and Sam in his role as assistant, and I'm a PhD candidate, which means very shortly I will be, all things being well, completing my PhD in a few short months. It means that when you're incentivized, it means that something's prodding you, something's pushing you. And I've already seen in my own time that you're encouraged to focus on particular kinds of things. Needless to say, my topic about removing race medicine from clinical diagnostics is not something that people are excited about. They like the idea that it'll do good, but they're uncomfortable with the fact that it uncovers and speaks directly to active racism by clinicians in healthcare, day to day, going in and out of their office. When, we end up in that hallway talk and they're like, oh, break down what you do again. They're like, I'm doing what? I'm using a test that was based on what? They never told me that in medical school. And this is someone who's been practicing for 20 plus years, who is horrified to find out that the diagnostic that they're using is literally not based on science, but ideology. And I'm like, oh yeah, I've got all the references here, you go. And they're just like, how is this possible? And it's possible because we live in a system of incentives. And one of the incentives in both the practice and the teaching of medicine, as well as in the practice of epidemiology and data analytics, is the incentive to produce without pushing up against what is the status quo. So just keep producing more of the same, and that's wonderful. And you'll be incentivized to do that. Folks that choose not to do that, have to grapple with some serious questions, which is what Sam was talking about, grappling with a particular kind of ethic, and being willing to, if need be, pay a cost. And that might be not going into a grant competition or not accepting a certain person on the grant team because of their careerist motivations, or not framing a question in the way that all your colleagues are doing just because, you're just going to tweak the question. Why spend that extra 2 weeks taking apart every word and reassembling it so you study racism and not race? And so this is about grappling with a kind of ethic that allows us to live out our constitutional protections safely. And I always make that link to people that if you can't stand in the light of the constitutional protections with the research question that you asked, and that is the lowest bar we can set, quite honestly, then what in God's name are you doing? And so I bring this to Sam now because this is part of the work that you do, pushing back and pushing people out of Jane and the neighboring area from trying to turn it into a petri dish because they've been incentivized for tenure. And that's the space where an academic goes from being a new, brand new professor to being a professor that is now, quote, permanently employed. And they incentivize you by saying, you know what? Maybe, Lana, if you didn't talk about race so much and talked about social demographics, people might be a little more comfortable. Have you thought of that? And that's even a conversation I've had to have with other folks that I'm supporting in their academic development around when is this appropriate and when is this part of being co-opted? So can you speak to that, Sam? Because in a role of community engagement, co-optation, it's right. It's right beside it. Part
of the fabric. It's the other name for it. Yeah. Community engagement is the synonym for co-optation. Yeah. I think I'll start with maybe another short story. I remember there was a Black woman, I think MA student at where I studied for grad school, and she was, they were doing their grant funding or SHRC, Social Science Humanities Research Council application for what her project was going to be, and it was very written in a sense, kind of, I want to sit with my community. Basically, I want to use this kind of framework. I want to talk about their school experiences. I want to talk about racism and schooling, and the white professor running the workshop basically said to her, yeah, no one cares about that in the department other than that Carl James guy. And I think that's a particularly honest moment because those kinds of proposals or, grad student proposals are internally ranked, right? So that tells you about the ways the institution tells you in what it's invested in, and whom it's invested in, right? So I think researchers of all stripes, or anybody who claims to do work on behalf of justice, might need to have an understanding about how social change happens, right? And how transformation might happen, and on which end of that arc the university most often falls, right? And then we think about our role in that. So, and I think it would be naive of us to think that many that claim to do this work on behalf of aggrieved communities, Black communities, or communities that are mired in struggle would be facetious, right? That we need to understand that most people would not be invested in the kind of ethical grappling we're talking about, right? So what happens? So we're thinking about the fact that we're right now, and you were with Naomi Klein last night, thinking about shock. We're currently in a moment of shock, right? Within which, because of COVID, because of the virus, we're very much thinking about how, and the government has poured massive amount of funds, right, into universities, thinking about, oh, we need to do research. We need to understand X, or we need to understand Y. That's very much the same response communities get when they're on the streets yelling for change, right? It happened with the Roots of Youth Violence report, with the Youth Challenge Fund. It happened with BLM, with the Black Action funding for Black communities, which was virtually the same amount with all that time in between, right? So very much that we need to study, we need to understand, we need to take pause. So we have to very much think that that being the gap stop, or the tool of institutions and governments to quell maybe a much more radical call for transformation, right? Imagine nobody on the street, I think, is yelling for a community consultation, or yelling for a community-based research report, or yelling for equality, or yelling for inclusion. So I think we have to at least, in these roles, it's our job to actually think about then what else might be possible. How else might we do this work differently if we claim to be on the side of justice or of Black communities? If that's not the case, then we just be honest about that and go do the work somewhere else. Because so often those who purport to speak on behalf of these communities very often get in the way, rather than allow some other kind of change or some other kind of work to happen. And they very often provide a mirage or a cover for government, right? So the Ontario government, where we are right now, where I am right now, has a anti-Black Black community fund, or Black community initiative. The City of Toronto has an anti-Black racism unit, and the City of Toronto also has a police budget north of $1 billion. So,
And Pat, can you jump in here?
Yeah, I was really struck by what the discussion was around incentives. I actually think it goes beyond that. So I mentioned that before I came to Canada, I did a lot of science in the US at Johns Hopkins. And, even though I had written that article in the late 90s about the bell curve and how epidemiologists are doing things that are not too dissimilar when they study race to what Murray and Herrnstein did when they wrote the bell curve, in terms of assuming that there are biological differences that are responsible for what seem to be inferiorities in non-white populations. I certainly did my share of science that divided samples into racial groupings and did some comparisons. But I don't know that I would say that I was incentivized to do that. I think that what was going on was that within my field, it was very much an ingrained practice and habit. I certainly at that time wrote about how we should not look at race, that we should look at racism instead. I taught about how we should measure racism and not race. But you can get swept away in this strong habit. It's not quite a pressure, it's maybe an undertow for the necessity of, when you've got race data there in epidemiology, to kind of blindly look at these racial groupings and compare. So it goes beyond just being an incentive, and that could be a danger that happens here, because we'll have that data available, because 9 times out of 10, when you look at racial groupings, you're going to show some inequities, and that's great to report because you have a p-value that's significant. So there's all kinds of incentives, but then built-in practices for us to use data in that way.
And I think it's a great moment to kind of come to some questions that we had around scientific racism. But before we do that, we're going to jump into this one that's come across the screen. And this is, in the US, where I see demographic data being asked for, it's opting in a marketing context. Very astute. Is this a hidden agenda behind collecting this data? I'm going to kind of go in here because, Sam, this kind of links back to the Black Experience Project. And so I'm sorry we can't get into explaining it because that would just take a whole show on itself. And maybe it will, because that's something that people asked me to speak to, but there's only so many things we can cover during the symposium. And so the question is, in the US, where I see demographic data being asked for, it is in a marketing context. Is this a hidden agenda? And I think that we have to think about the conversation we had last night with Naomi and the conversations we've had in part one. And it's important to think about the context, because this symposium talks about technology. We speak directly to how artificial intelligence works. And we have to understand that when we talk about these technologies, we're talking about corporations that build technologies that are designed to generate profits. And so when we talk about generating profits in healthcare, we have to understand that the instruments of advertising and the instruments of health demographics automatically are pushed together. And so is the blur of what the ethics should be and what the boundaries should be. And so actually it's not a hidden agenda. There's nothing hidden about it in the EMR and EHR business. There's a reason why there's 4 companies that own 90% of the electronic medical and health records in Canada. We talked about this last night, and TELUS is one of those. But who else is coming on the scene very quickly? Google and Amazon. And that's because they're data companies. And what is health but data to people in business? To you and I, it's our quality of life. To corporations, it's data, and that's the product. And so that data collection is about marketing. It's about marketing the next product that your government will buy to make your healthcare cheaper and make you easier to deal with at a lower cost margin. We've seen that right now. We saw in Ontario, which is where we're reporting from, the premier of this province is Doug Ford. He set out to delist, which means to remove from our universal healthcare system anesthesia provided during colonoscopies, which is an exam to see if you have cancer cells, and to have an instrument inserted into your body without anesthesia for most people is unimaginable and deeply uncomfortable. And so the idea that you would remove the anesthesia is about a process of privatization. So one, it means that you have to find separate insurance or shell out of pocket. And so the company that wants that business for your insurance needs the data, and they need your race-based data too, because they know that structural violence produces structural outcomes, and those structural outcomes pool among populations that have already been marked for stigmatization and exclusion. So insurance companies already know who was going to get hit in COVID because that's what they do with actuarial science. So is there a hidden agenda? There's nothing hidden. It may be hidden to lay folks that don't spend their time with data, but EMR and EHR companies are very clear about who they bundle and sell their data to. And we had that issue. You can go back and look in the Toronto Star when Hoskins was still in the Ministry of Health, where not the privacy commissioner didn't find it. No, almost everything that we found unjust in healthcare and data management has been found by investigative journalists and everyday citizens, not your privacy commissioner office. And then when pushed, the privacy commissioner finally investigated. And what did he find out? That in this case, you can go look it up and you'll see it in an article in the references. I'll speak to that later. It was TELUS who was taking your data and using it to push pharmaceutical products for your doctor to suggest to you, sound familiar, opioid crisis, and to use that data to find better, if you will, income generating opportunities within their corporate partnerships. So it is not a coincidence at this point that certain groups of Black folks are being encouraged to pressure the rest of us as Black folks to offer up data that has a clear monetary value that is almost not valuable to us as a population, because in fact, one, we don't need the state to collect that data. We can do it on our own. The technology is here for us. And two, we already have evidence also in Edmonton. And I'm going to move over now to the next question, and I'll talk about Edmonton a bit more as we ask this piece, which is narrative harms. So we've talked about narrative harms briefly, and narrative harms here we're referring to the stories that get told by the people who repackage this data and make the communities and the people that we are sound like completely often different things. So we've had this language of ethnic concentrations produced out of researchers here in Ontario. That language has been coupled with a language that does not clearly and explicitly state how these conditions came to be, but instead spends a lot of textual real estate articulating who is holding the bag for COVID infection rather than who produced it, which we know is poor policy. So I'm going to jump here to Sam a little bit around narrative harm. Given the work that you do, given the depositions that you've given at the city, which I've listened to, and at the police services, let's talk about how that narrative harm gets weaponized in police services and by the city of Toronto against its own citizens.
Yeah, okay. Well, thank you. I think they're obviously, I think, anti-Black. They're ahistorical, and they often, I guess, structure or paint their narratives always in ways that get to that blame the people for the condition, right? So very often you're going to speak, I guess, truth to power, or you're speaking to the institution, whatever it may be. There's always ways that they want, or there's always limits to the way in which they try to make you tell the story, tell the story. And it's often one of violence, right? So there's very, very often not the case that if we're talking about harm, or if we're talking about the redistribution of resources, or if we're talking about investment, or if we're talking about pushing back surveillance, if we're talking about any of those things, we're talking about violence. These are conversations that sometimes are not possible in these 2-3 minute deputations, or in an online petition, or in an action. So I think part of what I try to do, or part of the role that I think about, is how do we, if those are the terms, right? How do we then cut through? How do we use language that pushes back, that still irks the institution? I think about the role of lifting the veil, right? So often you get this conception or this orientation that we're giving voice or giving space, right? And I think that's something we fundamentally have to question and push back against hard. But thinking about how then do we pull back on the veil and try to tell the story of the violence of the institution, or the conditions under which folks are made to live, right? Which is still I guess is very much interested in how we make life, how Black life becomes to be possible, but also the conditions under which it's forced to operate, right? So I think about that in many ways, and I think that question goes back to how we either on by community side, how we produce the grants for community work and how we're encouraged to write those, or whether we're talking about the research projects that we say we're going to do. And I think if this is the terms, if this is the rules of the game, to use that phrase, then we have to think about how subversiveness and imagination operates, right? Because and I think that should be both on the social sciences and the sciences. We write the grants, or perhaps the research proposal of projects, in a particular way in the discourse of the state to get the resources we need to do the work that we want to do. And it doesn't mean that we have to call it, like, no matter if it's because the state gives us certain kinds of language that's valuable, it doesn't mean that that's what we have to use to talk to each other, right? So these ideas of racialized, visible minority, or all of these kinds of concepts that don't tell our story, or don't tell full stories, I think are ruses and things that we need to push back on. So I think that part, I think about that in the role of narrative. And I always think about, if we're in direct confrontation with the state, what is, or any institution, what is it that they don't want us to say? Where's the limit of what can be said? And then let me say something that's just a little bit over the line that won't get me into too much trouble. But that's what I think about when we think about narrative and harm, because it's so often that they would bring me on the radio or something or somewhere and say, oh, well, why don't you talk about violence in your community? Well, I say, okay, but there's a whole row of public housing that's going down. It sounds like that's violence to me, right? Because that's an inherent kind of violence that under which we're forced to live. So how do we tell those stories, right? I think that's what I think about when I think about narrative harms and marginalized quote unquote communities, and how do we tell those stories in ways that at least pushes us forward. And I think about pushing past the line.
And Pat, in terms of narrative harms, and you've done some work, very good work I might add, around concepts of scientific racism and the ways in which public health and epidemiology contribute to that. Can you just think out loud around narrative harms? And I'm thinking here about you speaking to how ahistorical and apolitical approaches to creating social demographic categories and this kind of thing are like literally generative sites of narrative harm.
Yeah, I would agree with you. And Sam, when I step back and I think about science, I think there's maybe some myths here. I mean, I think we all, maybe I, want to believe that science does good. I certainly, like Laura, went into science because we want to do good. We want to believe that we're doing science because it will help people and help society. But, in the area of science, and we're talking about narratives maybe coming from science, science is certainly prone to the same failures that we're seeing happening in all sectors of society. There's nothing special about science or scientists that protect them from having racist or sexist attitudes and behaviors that we see all around us. So if a society is sexist, so is science. Recall that until relatively recently, we excluded women from randomized trials on drugs for decades, and this left us with a huge gap in our knowledge that we still carry with us today. And if society is racist, so is science. And we can trace this racism through the centuries, from the early 20th century, when there was the eugenics movement. And we even today have these race-based genomic science activities that are going on. All of these practices are unified by the erroneous idea that human races are these naturalistic categories. And that kind of underlies this narrative that can happen when we do this work. And I think the concerning thing for me is when I wrote about the bell curve back in the late 1990s, I was calling out some of the science that we were doing at that time, suggesting maybe that low birth weight or preterm birth, they differed by race, and maybe those were inherent biological differences. I think what happens then is we say, okay, well, that's just the way it is. It's natural. And so we don't have to worry about interventions that might improve people's lives. If we go to the social sciences, Murray and Herrnstein and their bell curve, well, if low IQ is linked to race, then why should we invest in education? It doesn't make a difference because those are inherent differences. And I think those are the kinds of harms that come from what seem like subtle underlying narratives of biology and inherent biology when it comes to looking at these racial comparisons.
I want to come to Laura, but while I give Laura a chance to get ready to respond, when you talked about the genomics, race-based genomics, that we're seeing actually the rise of eugenics. And so for folks that aren't familiar with the term, eugenics is an entire body, it's a pseudoscience. However, it has been treated as a legitimate, and it is coming back to make claims of legitimacy, not just in genomics, but also in AI and machine learning. And so those technologies are being used as we speak to re-establish ideas that have been long debunked and discredited about being able to tell who is a homosexual by how close their eyes and nose are together, and who has a possibility of becoming a criminal based on their facial expressions. This is charlatanry at its best, but it is being given a lot of credibility in some of the halls of science. And I don't think it's curious. It's at the same time that white supremacy is gasping, grasping, and clawing to maintain power, that these things are happening simultaneously. We don't live in separate universes. In order to continue to establish and maintain white supremacy, you're going to have to find a new level of legitimacy. And if you can say, oh, it's in a complex yeah, that's it. It's in a complex algorithm. That's the story I'm sticking to. You couldn't possibly understand why you're inferior. Only we might know, which is the same unfortunate pseudoscience that's coming out of race genomics, making claims about ancestry and claims about disease patterns that any good mathematician has been able to debunk. But again, they hide behind the fancifulness of language and institution. And so these are narratives. These are narratives that produce the violence that we see from police officers. These are narratives that empower states to go against their citizens and fire. I might point out that the tear gas that you're seeing is the same tear gas that's being used in Afghanistan and in the Gaza Strip that's being used against actual soldiers and also against civilians. So the tools that is being brought against people seeking their freedom and seeking for a better, equal life are coming out of, a lot of times, being based on the science. Right? They're saying, oh, well, we have this body of, scientists. And so, Laura, scientists like yourselves, analysts like yourselves, who are being encouraged to produce a narrative, what are some of the challenges that you've seen, and what are some of the actions that a scientist would actually have to take to practice refusal?
Well, the first is actually understanding that we are creating a narrative. I think if you ask 100 analysts, are you creating a narrative with that analysis? 99 would say no. I think many analysts honestly believe that they're putting the letters on the page, but they're not writing the story. And they think that that's their role and someone else should write the story. So I think first is recognizing that any output, any analysis indeed does tell a story. And especially if that story is not made explicit, someone else will use it, put those words together in a way for you. And that's something that we have to acknowledge and understand. And so I would think that's step number one. Step number two is recognizing and having the courage to say, I don't actually think I have the skills or experience to tell this story properly with whatever analysis we're doing. And actually, maybe I'm not even looking at it the right way. I have all these blind spots. I don't understand the history of what's happening here. I don't know how to measure these things. I barely know the difference between race and ethnicity. I don't know the difference between these categories. And we need to either step back and say, have the courage to say, I can't, I don't have the expertise, and I might do more harm than good. Or we need to partner and work together on it and respect the expertise that other people will bring to this analysis, so that whatever comes out on the other side, whether we think it's a narrative or not, explicitly or not, actually comes a little bit closer versus someone else trying to do that for you.
And I want to thank you for those contributions, because it, oddly enough, had something pop up in my mind that I think relates to an earlier conversation. But for right now, I want to bring this question forward. How can public health workers that don't often have a therapeutic alliance with their clients promote trust when collecting information, for example, race, that's been historically used against community members? And so asking in the context of my current work as a COVID contact tracer, when I ask cases for info, there is explicit mistrust. I am Canadian. Why do you need this info, and what will you do with it? Well, I'm going to take this to Pat, Sam, and Laura. And I think I want to bring a thread forward, because one of the reasons I'm moderating all of these panels is not because it's just interesting, because I actually am very uncomfortable on this on this media, but it's because I want to make sure we bring the threads forward through all of the conversations. And one of the things that was said on the Saturday night panel, and echoed also by Desmond and by Idil and said by Ruha, which is, there is no honesty or appropriateness in expecting anyone to trust public health or any state institution, that trust has been disearned. And there should never be an attempt to restore trust, because the institutions know themselves to be untrustworthy. And so I liken that very much to, when we teach, folks how to take care of themselves. One of the things we talk about, especially around gendered violence, is believe yourself when you get that feeling that it's time to make a move, right? Having worked in sexual violence resistance work, many times survivors have said, there was just that feeling that I got. There was something where I knew the wind had changed, and I knew but I thought, oh, I'm being silly, right? We talk ourselves out of it. And so as we go into answering this question with each of you, I want to bring back Ruha's words, which are, the instance have earned the distrust. It is not the job of you as a public health worker or contact tracer to dupe someone into trusting you when your own head of the agency has declared that they work with the police in many instances and have yet to give a briefing of what those instances were and have yet to be held accountable. And so Ruha advised, as do many other scientists and academics, that it's not wise to trust someone that's proven themselves to be untrustworthy. So I'm going to hand it over to you all to bring your own piece in from this particular session, because that was feedback from the other session.
Yeah, you put it very well. I'm not really sure I have much to add. I think, maybe just not to go over what I already said, but I think that there's a very high risk for using these data in ways that are harmful. Again, if society is sexist or racist, so are the activities that are going on in science and in public health departments. I think one way to try and overcome that is for us to work together on figuring out what data to collect and what to do with that data, so that you don't have to worry about whether you trust somebody or not, because you're there at the table deciding what to do with data, when to collect it, how to collect it. Because one of the problems is when you give that data over, it could be used in 100 different ways. If you want it just used in one way, you should be able to say that. You should be able to co-create the use of that data.
And I want to take it up to you, Sam. I mean, one of the pieces that you're involved in and have been involved in some time is developing a protocol, an ethics for which people should be engaging with the members of the community that you live in. And contact tracing is fraught with challenges, especially in this age, because yet has the province and the country decided to divulge to us who has their hands on our data. For those of us that are in the back end of things, we know that at the very tables that we sit at, we have different kinds of ethics, because Google is sitting there and a number of corporations are actually handling your data, and the public health has yet to be honest and forthcoming about what that looks like at the ministerial level, what that looks like at the municipal level, that some of the people that are doing your data are also the same people that are increasing the value of shares for publicly and privately held companies. And so I think that the individual that asked this question probably doesn't even know who's handling the data and how many shares they have. And they're being made to believe that this is only a public service. And so given your community and their desire to have a particular framework used, and contact tracing didn't even bother to ring a phone, didn't bother to ask what is the appropriate way, what do you say?
Yeah, no, I think it's an important question, and I think that hesitancy, or that why do you need this data? I think if we're thinking about just standard normative research ethics, that means that's not informed consent, right? Because we don't know why this data is being used. If the person to whom that question is being asked does not know where that data will go or why it's being asked, then that means informed consent is not present. That's one thing. I want to think about how that kind of refusal to answer the question or to give the data gets read, right? So I've worked in a lot of schools where you have a lot of teachers who say, oh, well, the parents never come. And then you hear from the parents who was like, listen, they never treat me right. So that refusal to not enter into that building or space is actually informed, it's rational, it's generational, and it comes from a place. Such is the same with health, right? If Black folks are not really interested or do not trust, rightly so, the health practitioners or the entire system or infrastructure behind it, that refusal gets read as not wanting care, right? So we have to think about that kind of refusal, or that kind of informed refusal, you use the term. I think those things are important, and to say that should force the lens, I think, to turn back on itself. We know very much often that's not the case, but also thinking about how so much operates without so much the data moves. I think you said last night, Alana, how how data is never stationary. It always moves, right? And how we are so often not privy to its movements. So in our province where we both are, the COVID testing data has been shared with all police forces, right? So we have to really sit and think about how our politicians or the state thinks the role of police is and what they might do with this data, if not only just to enact violence in a more informed way. But we have to think about not only our role in refusal, but how very often this infrastructure, this data infrastructure, may operate without even or outside the bounds of our abilities or even communal abilities to be able to refuse and push back. I think that's very important.
And I'm going to ask you, Laura, to weigh in here. Contact tracing is important, right? So I want to bring the other half of the argument. Contact tracing is important. Like, you know, I'm somebody, I've done a lot of work in, you know, in HIV and infectious disease, and contact tracing, just as a definition, is, you know, if there is a site where someone has either become infected by an agent, a virus, a bacteria, you want to know who else might have been exposed to it through any kind of contact, and you want to literally contact that person and let them know so that they can either get screened or get assistance or just be aware of what precautions. So in and of itself, contact tracing seems so wonderful, so benign. How could you ever say a bad thing about giving information, Lana, or any of these discussants about contact tracing? But we've gotten some other lenses here, right? And so, Laura, contact tracing is important and it's valuable, but what does it mean when we're trying to engender trust when, as you said, many people don't even know who are asking for the data, where it goes, and that it's being shared with police forces and tech companies under various guises. So when someone like yourself has to engage with an ask, either from a municipality or a province, what might you say now? Because I'm not sure if you've ever had a chance to think about it, so it's a bit of on the spot, but what would you say now that we're in the middle of this conversation? Would anything change for you? And would you say anything? And I want you to talk to your peers as you answer this, folks who are also data analysts, who are also grappling with these decisions, or maybe as a result of this conversation are like, holy moly, I didn't even see that pitfall.
Yeah, I mean, I would say, and I feel, you know, I feel for them as well, because I know we think we're doing the right thing. We're being told we're doing the right thing. And we know that contact tracing is important. It's one of the things that's going to help protect, you know, it even goes the other way. Maybe contact tracing is actually going to protect the communities we care most about, right? So that's the piece to struggle with. I think it goes back to transparency, trust, oversight. I'm hearing things today on this panel that I didn't know. I didn't know where data was being shared. I certainly don't know, and I probably know more than many people, but I don't know everything. So I think that, you know, maximum transparency is really critical. Because if there's nothing wrong, then everybody's sharing where this data is going, what it's being used for. Then that's the first step to try and, or else people will undoubtedly, you know, have concerns about what data is being collected and why. And then the second thing is, what's the minimum criteria needed to get the job done? So the job is, when somebody's infected, we want to make sure that them and everybody around them gets tested, and that we've followed up to make sure that the infection doesn't proceed further. That's the health protection role of public health. So if that's the goal, health protection, what information is needed for that goal versus all the other things that are also important that might be needed with the data? And the more that we mix and confuse these things together, the harder it is to justify to anybody. And that's where the trust starts breaking down. And so clarity on what do we need for what purpose and what action will follow, I think is critical for this piece.
Okay. I think we have another question coming in. Yes, we do. How can we take back control over our data without affecting our healthcare is a very important question we must ask ourselves. And so I'm going to jump to Pat, repeating the question: how can we take back control over our data without affecting our healthcare? And that's an important question.
Wow, that's a really tough one. You're right. It's a very important question. I mean, we need data in order to understand what's happening with our populations, in order to understand disease progression, in order to understand lots of things about healthcare and health. Yeah, I'm sorry, I don't have the answer. I don't know, maybe you do. Maybe the audience does. I'd love to hear what you have to say.
I'm going to throw it to you, Laura, and I think it's great because we don't have to have all the answers, but we can have some thoughts. I'm going to finish with Sam, and then just to give you guys a chance to think about it, we're in the last little bit, so I'm going to, after I ask Laura this, I'm going to ask folks to share 2 thoughts that they want folks to leave with, and ideally, one is going to be to your peers, so for our CRCs, and Sam, other assistant professors, and also I'd like you to give a commentary like to folks who aren't of this world that we have entered into. So just as we finish off with Laura, given that we need data, is there a way that we can take control back without compromising our healthcare system? Do you think it's possible? How about we start with that? Do you think it might be possible? How, we may not know, but do you think it's possible?
Yeah. I mean, I'm an eternal optimist, so I'm going to say it's possible, but there definitely needs to be changes in the way that we work with data and how that data is shared. At a minimum, for example, individuals should have access to their own data. And I think that that's something that many people have been calling for a really long time and would go a long way. And, the other piece about understanding the structures and oversight of that data and how it's used. And I maybe feel like a little bit of a broken record, but the problem is when things are being held back and there isn't transparency, there's doubt. And as you've mentioned, and everyone's mentioned many times, and I'm learning more each day, we don't really have a great track record that that data is going to be used for great purposes and it won't do harm. So in the absence of that track record, how do we ensure that? Transparency, trust building, governance, and those things are going to take time to build and actually are quite a bit different than where we are today. So just taking a moment to understand that that's not going to happen overnight. That's not an easy just those things. It's going to take time, and we need to be patient about that.
And Sam, I'm going to ask you to, because I know that there's work going on in community where taking control of data and healthcare, you're doing a part of that now. Can you share just a smidgen about that, if you will?
Yeah. I guess thinking about the Jane and Finch community and some of the ways in which it's over-researched, over-policed, underfunded, underhoused, lack of food security. So those kind of conditions are prime for researchers, I think. So thinking about some of the work that we've been trying to do along with Talisha and Abena, is thinking about how do we enact a certain kind of community-based refusal, right? How do we take control of our own narratives and our own participation? How do we educate and work with each other to produce a certain kind of critical resistance? Because we will constantly be the fodder or the source of the narrative harms to continually tell stories that researchers could have told without ever coming to the community. And that's been going on for generations and for decades, right? There was researchers from Germany contacted me thinking about wanting to do research projects in Jane and Finch. So this is entirely ridiculous. So some of the I guess community-based resistance was thinking about how do we form our own ethics. And this work has gone on for over 10 years, right? Thinking, and this is how long it takes to think about what would be a certain kind of framework or resistance that we can inculcate into our own community. So that's some of the work that we've been trying to do, I think, in that part of our city. It's also happening over in Vancouver and Lower East Side. It's happening across different cities in the U.S. And I think what we might want to think about is how research can either be, I think, a certain kind of ceremony. It can produce narratives that could be critical in the fight for a certain kind of transformation, or it could just reproduce violence. And I mean, I think those pathways or those poles of that spectrum are not that close. And I think we can think about how maybe questioning how the university in of itself, that is its role, right? If unless we operate inside it, against it. And I think about that actually a couple times a day, in the ways in which I'm asked to do this or that role, and thinking about to whom am I accountable, and who am I listening to, and to whom might this task or that project serve. I think that, and then I think we have to, at least as much as we can, the only thing we might have or share is our participation. So just thinking about how researchers may be handmaidens to produce or reproduce a certain violence that we're pushing against, and how do we not do that?
Thank you. Pat, 2 things you want folks to leave with, at least one for your peer and one for others.
Okay. So if we decide to use a race-based approach, and then I think we should, and this is sort of in the academic literature, I think Chandra Ford and her colleagues have put forth some principles that are aligned with critical race theory. One of those principles is centering from the margins. That approach really upends the process of having the majority group starting the conversation about what matters, to grounding the start of a conversation in the experiences and perspectives of those with lived experience in the affected communities by sharing power and enabling those with lived experiences of the issues under to kind of drive the study conversations. So I think that would be really important. And I think it's aligned with what Naomi Klein said yesterday about we have rights as co-creators of data to shape what we collect and what to do with it, but that option is never put out in front of us. I guess the second thing is we really need to measure what we actually think is happening. Mm-hmm. And we, usually it does not lead to the variable race. Race is a proxy for other things. So if we're interested in those upstream social determinants, then let's be doing research on those things, because that's where we're going to actually make the change.
Thank you. And Laura, what are 2 things, at least, that you want to share with your peers and with others that you hope that they leave with?
Yeah, so the first is really acknowledging that we have a responsibility and we have a role in the narrative, as much as we think the data are separate from the actions, or we didn't create it, we're just using it. Just really pushing back and thinking critically about how we can change that thinking and at least not do further harm, acknowledge the potential harms that exist and work towards fixing that. That's something that I'm really taking away. I think for everybody, I want to listen more. That's what I want to do, and understand and work with others more. And so that's what I'm going to end with.
Okay. And I am going to have Sam jump in and give us the last 2 things he wants folks to leave with.
Okay. I think I'm thinking about what refusal might be, not just for communities who are pushing back against research as violence or being over researched, but what refusal might be for researchers, right? Who are all too often encouraged to reproduce status quo. So how might we instill a certain kind of refusal, not only for communities who are under the hot light of the lens of the research, who are always burdened with that kind of work, but how do we make researchers engage in that work? And then also, I like the idea of what we might think about as how do we think about not reproducing the same kinds of projects or the same kinds of questions that tell us things that we already know about communities, which doesn't do, I think, anything for us. So what are the kinds of work and the kinds of questions that will help, push for a different kind of world, a different kind of life, a different kind of way of organizing life? That's what I'm thinking about.
I want to say thank you to all of you, and I'm going to, as we do our outtake, I'm going to read these pieces coming across the screen. In a white supremacist system that needs data evidence to prove its violence, but never actually do anything about that violence, there is no point or purpose to take back control of their useless surveillance mechanisms that don't even ingrain a critical framework to addressing the realities of Black and racialized Black and racialized folks face. We need to build our own mechanisms as community from the ground up and retain our own community-controlled sovereignty. And I think that's a wonderful note to end on. It rings true through our series. We've had a number of folks who have a lot of experience and knowledge in these areas, who aren't engaged in expert drift, who have spoken to us. And I think they've come back to that again and again. And one of the things that I want to say to you is thank you to each and every one of you. And I look forward to working and speaking to you as time goes forward. For right now, I'm going to do the outtake. And I'm going to say to folks, I'd like you to definitely come and join us tomorrow from 10 to 12. We have the next session. And I'd also like to take this moment to say thank you to The Leap, who has been great in supporting us with making sure that folks know about this event, and also with providing some other supports around sharing information and whatnot. So I want to say thank you to The Leap for that. They've been amazing. As most of you know, this has all been done on our own backs. This is not backed by an academy. This is not backed by a community organization. This is backed by people who are committed into invested and putting our time in. And I'd also like to point out to you guys, now that we're on this medium and we've moved from the streets and doing work in the streets to being online now due to COVID and a number of things, we'd like you to visit REDE, REDE, which stands for Research, Evaluation, Data Collection, Ethics for Black Lives. And so we've come to this channel out of a demand and a request from the community folks that we've met with across the country as we've educated ourselves and talked about data. And when you go to readyforblacklives.com, you will see that we have a protocol there underway. It's outlined. If you would like to meet with us to discuss portions of the protocol, what you might use, how it works, what are some of the toolkits, go on that site. We have the ability, if you type in your name and your address, you can message us and we will follow up with you, because in fact, we are building those tools. And we as community, especially those of us who are comfortable with technology and are on the younger stream of things, are moving forward and building those systems that have nothing to do with public health units or big tech, but in fact can inform them and support them and make contact tracing quick and effective and meaningful. So I want to say we look forward to seeing you tomorrow morning at 10 a.m. and you are going to love it. We have the next generation of public health physicians and researchers. See you there. Bye for now.